but they're looking for validation. They're looking for emotional support. It's kind of all fun and games up to you to the point where you get to the night before surgery. Then it becomes anxiety provoking. Once you have the surgery, it becomes a bit of an emotional roller coaster. It becomes sometimes depressing. And sometimes clients don't have the support they thought they had or really didn't have the support they needed going into that. So these groups can be a measure of support during this journey is challenging. It's not impossible, it's not tough in the sense that you can't make it, but it's challenging. So, these groups offer some emotional support. And then people who are just curious. They may not be really super interested. They're just thinking about it. They're starting their journey. They're kicking the can down the road. These groups can be a gateway to kind of get information and kind of experiences to help guide the curious person to walk them either down the road or walk them away from the road. So they definitely help in these regards. But generally, what I'm saying with all those kind of check boxes, these groups offer a sense of community, and we all at some point and in some regard are looking for a sense of community. So those are some good points. Piggybacking on that, you know the pros really are, you have peers, you have, and these are mostly women's groups. There are a few men's groups for sure, but you have peers who are supporting you. You have women who or your age, your culture, your ethnicity, your height, your weight, and you have their support, you have their guidance, you have, again, their validation or blessing in some degree. So it serves, clients and potential patients very well. These platforms share experiences. That's really what they're meant to do. They're meant to share experiences, good, bad, ugly, and indifferent, so that you kind of get a flavor for everything, so that you don't go in unarmed or uninformed about what could happen. Because I believe everybody does plastic surgery disservice. We as plastic surgeons do it as a disservice. Clients or patients do it disservice because what they do on Instagram and Facebook and TikTok, they show you the before when they were not where they wanted to be, and then poof, they show you the after. There's a big, long story in the middle, and no one really talks about that. So we've got to make sure that we share those experiences, and so people can get when things go great, when things are going wrong, when things are kind of equivocal, you don't know what to do or which way it's going. And of course, at the end, when things ultimately work out, people learn about a lot of things. Some of the docs that are on here do chime in from time to time, and they kind of shed light on subjects where there's a lot of chatter, and they try to add validity and good information. So it's an educational component. And then there's a lot of educational component from the community members themselves, because a lot of the community members are in healthcare. They are nurses or respiratory therapists. And, I've not seen a female doc or a male doc on there as a patient, but I'm sure there could be. But typically, a lot of the clients identify themselves as nurses or X-ray techs or surgical scrubs or surgical technologists. Let me be correct. All over the healthcare spectrum. So you can get a lot of knowledge from these people who are in medicine that just happen to be patients. So it's really a lot of educational support as well. And then lastly, a pro is that you have a lot of emotional support, as I mentioned earlier.